If you are over 65 and your joints hurt, you have probably already been told it is arthritis. Maybe your doctor said it after looking at an x-ray. Maybe you said it to yourself. After years of stiffness and aching, that seemed to come with getting older. And maybe the conversation stopped there. Arthritis, as if that one word explains everything. As if knowing the name is the same as understanding the condition. As if arthritis is a single, simple thing that works the same way in every person it affects. But here's what I want you to know today. Arthritis is not one condition. It is an umbrella term that covers more than 100 different conditions, all of which cause joint pain and inflammation, but which have very different causes, very different mechanisms, very different treatments, and very different implications for your overall health. And the most common types, the ones most likely to be affecting you right now. If you are over 65, are different enough from each other that treating one as if it were the other can mean years of ineffective management, and in some cases, mistreatment that could have protected your joints, your heart, your kidneys, and your quality of life. I am Dr. Daniel Chen, and today I want to sit with you and explain the most important types of arthritis that affect adults over 65, what makes them different from each other, how doctors tell them apart, and why getting the right diagnosis is not just a formality, it is genuinely one of the most important things you can do for your long-term health. Let us start with the numbers, because they tell an important story. Arthritis is the most common cause of disability in the United States. According to the Centers for Disease Control and Prevention, approximately 53 million American adults have been diagnosed with some form of arthritis, and among adults over 65, more than half have arthritis. That proportion rises with age, so that by the time adults reach their mid to late 70s and beyond, arthritis is essentially the norm, rather than the exception. And yet, despite how common it is, despite how many people are living with it, the conversation about which type of arthritis and what that specifically means for that individual person is far less common than it should be. So let us talk about the most important types. The first, and by far the most common, is osteoarthritis. Osteoarthritis is what most people mean when they say arthritis. It is the type most likely to be visible on an x-ray and most likely to be mentioned after a brief clinical assessment. Osteoarthritis is a condition in which the cartilage, the smooth protective tissue that covers the ends of bones inside a joint, gradually breaks down over time. Cartilage serves a critical function. It acts as a shock absorber, distributing the forces of weight bearing and movement evenly across the joint surface, and it creates a smooth, low-friction surface that allows the bones to glide against each other. With minimal resistance, when cartilage degrades, the smooth surface becomes roughened, uneven, less able to distribute load. The bones beneath the cartilage react to this changed load distribution by forming small bony outgrowths called osteophytes, or bone spurs. The joint space narrows, visible on X-ray, as the gap between the two bones becomes smaller. Inflammation in the joint lining, called the synovium, can develop, causing swelling, warmth, and pain. And the joint gradually loses its range of motion, its stability, and its ability to absorb the demands of daily life. Osteoarthritis most commonly affects the knees, the hips, the hands, particularly the joints at the base of the thumb and the end joints of the fingers, the spine, particularly the cervical and lumbar regions, and the feet, particularly the joint at the base of the big toe. Now here is something important that I want to be clear about, because it is very often misunderstood. The amount of osteoarthritis visible on an X-ray does not reliably predict the amount of pain or disability a person experiences. This is one of the most well-documented and most clinically significant discrepancies in musculoskeletal medicine. Many people have significant cartilage loss visible on imaging and experience relatively little pain, while others have modest changes on X-ray and experience significant and limiting pain. This means that managing osteoarthritis based solely on what an X-ray shows, without considering the person's actual symptoms, functional limitations, and overall health picture is not adequate, and it means that hearing your doctor say you have arthritis on your X-ray should be the beginning of a conversation, not the end of one. The second type of arthritis is rheumatoid arthritis, and it is fundamentally different from osteoarthritis in almost every important way. Rheumatoid arthritis is not a wear and tear condition. It is an autoimmune disease. In rheumatoid arthritis, the immune system, which is designed to attack foreign invaders like bacteria and viruses, mistakenly attacks the body's own joint lining, the synovium. This immune attack causes sustained, aggressive inflammation in the affected joints that over time, if not properly treated, erodes the cartilage and the bone itself, causing permanent joint damage and deformity. Rheumatoid arthritis typically affects different joints than osteoarthritis. It most commonly affects the small joints of the hands and wrists, particularly the knuckle joints and the wrists, in a symmetrical pattern, meaning the same joints on both sides of the body are affected simultaneously. It causes significant morning stiffness that typically lasts more than an hour and improves with movement. Unlike the stiffness of osteoarthritis, which tends to be shorter and triggered by prolonged inactivity, and it causes what doctors call systemic symptoms: fatigue, low-grade fever, malaise, a general feeling of being unwell. That reflects the fact that rheumatoid arthritis is not just a joint disease. It is a whole-body inflammatory condition with implications for the heart, the lungs, the eyes, and the blood vessels. This is why the distinction between rheumatoid arthritis and osteoarthritis matters so profoundly. A person with rheumatoid arthritis who is not properly diagnosed and treated is not just suffering from manageable joint pain, they are living with an active autoimmune disease that is progressively destroying joint tissue, and that is associated with a significantly elevated risk of cardiovascular disease, a 2 to 3-fold increased risk compared to age-matched adults without rheumatoid arthritis due to the systemic inflammatory burden of the disease. And that elevated cardiovascular risk can be significantly reduced by proper disease management with appropriate medication under the care of a specialist called a rheumatologist. Rheumatoid arthritis is diagnosed not just by symptoms, but by specific blood tests, including a test for rheumatoid factor and a more specific test for anticyclic citrullinated peptide antibodies called anti-CCP. These tests help confirm the diagnosis and assess disease activity, along with markers of inflammation, such as C-reactive protein and erythrocyte sedimentation rate, and it is treated not with pain management alone, but with specific medications called disease-modifying antirheumatic drugs, or DMARDs, that target the immune mechanisms driving the disease, protecting joints from further damage, and reducing the systemic inflammatory burden that elevates cardiovascular risk. The difference between proper treatment of rheumatoid arthritis and simply taking pain relief for what someone assumes is general arthritis is the difference between joint preservation and progressive joint destruction. And that difference begins with the right diagnosis. The third type that I want to discuss is psoriatic arthritis. Psoriatic arthritis is another autoimmune form of arthritis that affects approximately 30% of people with the skin condition psoriasis, but it can also occur in people who have minimal or no visible skin psoriasis, making it easy to miss. Psoriatic arthritis can affect any joint, but often has a distinctive pattern, including inflammation of entire fingers or toes, a condition called dactylitis, which gives the digits a sausage-like swollen appearance, inflammation at the points where tendons and ligaments attach to bone, called enthesitis, which causes pain in specific spots, like the heel, the bottom of the foot, or the elbow, and sometimes involvement of the spine, similar to a related condition called ankylosing spondylitis, like rheumatoid arthritis. Psoriatic arthritis is a systemic inflammatory condition with implications beyond the joints and requires disease-modifying treatment, not just symptom management. The fourth type is gout. Gout is the most common inflammatory arthritis in adults over 65, and it is one of the most misunderstood and most undertreated forms of arthritis. In this age group, gout occurs when levels of uric acid in the blood become elevated, and uric acid crystals form and deposit inside joints. These crystals trigger an intensely painful inflammatory response that typically comes on suddenly, often at night. and most classically affects the joint at the base of the big toe, although it can affect the ankles, knees, wrists, and other joints. A gout attack, which doctors call a flare, causes severe pain, swelling, redness, and warmth in the affected joint. That is often described as one of the most painful experiences a person can have. Gout is more common in older adults for several reasons. Kidney function declines with age, reducing the efficiency with which uric acid is excreted. Many medications common in older adults, including diuretics, low-dose aspirin, and certain blood pressure medications, raise uric acid levels, and conditions common in older adults, including obesity, high blood pressure, diabetes, and kidney disease, are all associated with elevated uric acid. Now, here is why proper diagnosis matters so much with gout. Gout is not just painful, chronic gout with repeatedly elevated uric acid levels and repeated flares. It is associated with the formation of uric acid crystal deposits called tophi that can permanently damage joints and with significantly elevated cardiovascular risk due to the systemic inflammation associated with chronic elevated uric acid. But gout, unlike osteoarthritis, has a specific measurable cause, elevated uric acid, and specific medications called urate-lowering therapies, including allopurinol and febucostat, that can lower uric acid to a target level below which crystals dissolve and flares stop occurring. Gout is one of the very few forms of arthritis that can be genuinely controlled and in many cases effectively eliminated with the right medication taken consistently at the right dose to maintain uric acid below the target level. But this requires a proper diagnosis, a uric acid blood test, ideally taken between flares, and a treatment plan that targets the underlying uric acid level rather than just managing the pain of individual flares. Many older adults have gout that has been inadequately treated for years because the focus has been on pain management during flares rather than on uric acid control between them. If you have been told you have gout, ask your doctor specifically what your uric acid level is and what the target level should be, and whether you are on urate-lowering therapy at an appropriate dose to reach and maintain that target. Now let me talk about something that applies across all forms of arthritis, and that I think is one of the most important messages of this entire video. Pain is not the only reason that getting the right diagnosis matters for older adults with any form of inflammatory arthritis, rheumatoid arthritis, psoriatic arthritis, gout. There is a significantly elevated cardiovascular risk associated with the systemic inflammation of those conditions. That is independent of and additional to the other cardiovascular risk factors the person may already have, and that elevated risk is meaningfully reduced by proper treatment of the underlying condition. This means that a 70-year-old who has been living with what they assume is just general arthritis, but who actually has rheumatoid arthritis or gout, is not just experiencing unnecessary joint pain. They're carrying an additional cardiovascular burden that proper treatment could reduce. The diagnosis matters, not just for the joints, but for the heart. Now let me tell you what a proper arthritis evaluation actually looks like, because I want you to know what to expect and what to ask for. A thorough arthritis assessment goes beyond looking at an X-ray and saying, yes, there is some arthritis there. It includes a detailed history of your symptoms, which joints are affected, how the pain started, whether it is worse in the morning or after activity, whether it is symmetrical, how long morning stiffness lasts, whether you have systemic symptoms like fatigue or fever, whether you have any skin changes like psoriasis, a physical examination of the affected joints, checking for swelling, warmth, range of motion, tenderness, and deformity, blood tests, including inflammatory markers, uric acid, rheumatoid factor, anti-CCP antibodies, and a full blood count, and urine tests to assess kidney function, which affects both the risk of gout and the safety of certain arthritis medications, imaging, including X-rays, and sometimes ultrasound or MRI, to assess the joints more thoroughly, depending on the clinical picture, if there is any suspicion of inflammatory arthritis, rheumatoid arthritis, psoriatic arthritis, or gout. A referral to a rheumatologist a specialist in joint and autoimmune conditions is appropriate and important. And if you have been diagnosed with osteoarthritis, but your symptoms are severe or worsening or significantly limiting your daily life, a referral to an orthopedic surgeon or a physiatrist, a specialist in physical medicine and rehabilitation, may be appropriate to discuss all available treatment options, including physical therapy, joint injections, and in appropriate cases, joint replacement surgery. Let me bring everything together now. Arthritis affects more than half of all adults over 65 in the United States, but arthritis is not one condition. It is an umbrella term covering many different conditions with different causes, different mechanisms, and different treatments. The most common types in older adults are osteoarthritis, which is primarily a cartilage breakdown condition driven by mechanical factors and aging; rheumatoid arthritis, which is an autoimmune disease with systemic implications, including significantly elevated cardiovascular risk; psoriatic arthritis, another autoimmune condition that can affect any joint and is often missed, because not everyone with psoriatic arthritis has obvious skin psoriasis; and gout, the most common inflammatory arthritis in older adults, driven by elevated uric acid, and specifically treatable with urate-lowering therapy. Getting the right diagnosis is not a formality. It determines the treatment, the monitoring, the additional health considerations, and for inflammatory types of arthritis, the cardiovascular protection that comes with proper disease management. If you have been told you have arthritis and the conversation stopped there, I want you to go back and continue it. Ask what type of arthritis you have. Ask whether any blood tests have been done to assess for inflammatory or autoimmune causes. Ask what your uric acid level is. If you have ever been told you have gout, ask whether a referral to a rheumatologist is appropriate. Ask what your complete treatment plan looks like, not just for pain management, but for joint protection and cardiovascular protection over the long term. You have been living with joint pain for long enough to deserve more than a word and an x-ray. You deserve a real diagnosis and a real plan. I am Dr. Daniel Chen. If this video helped you understand something that you have been living with but never fully understood, please share it with someone over 65 who has been told they have arthritis and left the appointment without understanding which kind or what that truly means. Subscribe to this channel for weekly videos made with genuine care for older adults who deserve real information about their own health. And leave me a comment below. Tell me which type of arthritis you have been diagnosed with and whether the conversation with your doctor has gone beyond the diagnosis itself. I read every single comment, and I genuinely look forward to hearing from you. Take care of your joints and take care of your whole self, because arthritis, when properly understood and properly managed, does not have to define how you live